I'd really now like to, it's with great pleasure to turn the floor over to Sujata Dayal, Vice President and Global Chief Compliance Officer for Medline Industries, as well as the Chair of the Chief Compliance Officers Committee of the Advanced Medical Technology Association, AdvaMed, who will facilitate our next panel session, as mentioned, healthcare professional voices in advocating ethical conduct. Sujata is a true global champion when it comes to elevating ethics and integrity in health systems. I've known Sujata for a long time, and she has supported a number of initiatives that have achieved major milestones over the years, whether it's the G20 or the B20 and APEC and beyond. So Sujata, thank you so much for being with us today. I turn the floor over to you, and I'll just acknowledge up front that I believe one of your panelists is still in the process of switching over, so we'll look at that while you get started. So Sujata, over to you.
Thank you so much for that introduction, Andrew. It is so exciting to be here. I can remember when we started with the APEC principles in Gifu, and look where we are today. So welcome to everyone to this particular session. As you know, when we talk about ethics and integrity, it is a partnership between everyone that's involved in the health systems, whether it's healthcare professionals, institutions, industry, government. And so our panel is really going to focus on the role of healthcare professionals in advocating ethical conduct. I think healthcare professionals actually play a very unique role because they are truly the trusted intermediary for patients and people. And so as a trusted intermediary, I think healthcare professionals can really move the needle in terms of building trust and transparency, as well as establishing groundwork for how governments and industry should interact with them. So with that, we are very privileged to have a very illustrious panel. I'm going to ask each of my panelists to maybe take a minute or two and introduce themselves. And maybe as you introduce yourself, you can share with us what you think are the most exciting opportunities or challenges in this quest to have healthcare professionals, advocate for ethical conduct. So, what do you think the most important principles or challenges are, or something that we should focus on? And maybe I'll go alphabetically and start with David.
So thank you very much. Really good to be with this group today and excited about this conference. I'm David Barb. I'm a practicing family medicine physician from rural southern Missouri in the United States. That's the central part of the country. And I currently serve as president of the World Medical Association. For those of you who are not familiar with the WMA, it is an organization of about 115 national medical associations from around the world. We represent almost 10 million physicians around the world. And I think it is important to start this conversation by reminding us, ourselves and others, that the medical profession has significant standing when it comes to ethics, especially around medicine and healthcare, of course. Essentially, all national medical associations have ethical code and principles. The American Medical Association, for instance, was established in 1847, and one of the first things they did was establish a code of medical ethics. Same thing with World Medical Association, established in 1847. So number one, we need to assert our standing in medical ethics. Number two, particularly in pandemics such as the one we're experiencing now, when it is a healthcare crisis. It's somewhat different than the natural disaster such as an earthquake or a typhoon, in which we have an ongoing health crisis where we have limited resources and clear prioritization is going to be needed. So I think involvement of physicians and medical organizations at all levels is critical, and I think we have seen that in this pandemic.
Thank you, David. Jeff, maybe we can go to you next.
Sure, thanks very much. And again, pleasure to be here, and many thanks for the invitation to be on this great panel. I'm Jeff Blackmer. I'm the Executive Vice President of Global Health and the Chief Medical Officer for the Canadian Medical Association based in Ottawa, Canada. In terms of opportunities, and some of this will reflect the comments that David just made as well, I think healthcare providers really have established themselves as a credible voice that patients and the public look to be guided by science and evidence. And this has become more important at this point in time than probably ever. And this really provides us with the credibility and the legitimacy when it comes to setting not just scientific and medical, but ethical standards as well. And that's critical for the profession. I think one of the challenges that we have is that while individual healthcare providers are generally very well regarded and very well trusted by patients and the public, we need to continue to work very hard to make sure that our organizations are seen in that same light. And again, this, I think, reflects a little bit what David was talking about. We all have codes of ethics and professionalism. We need to make sure we live and breathe those every day. And part of that involves continually making sure that we reflect on potential conflicts within our organizations, and that we really continually put the patient and the profession at the center of everything that we do. Sometimes that's easier said than done, but anything that we do to erode that trust really will come back to haunt us in the future. We need to make sure that we live our ethical standards every day.
Thank you, Jeff.
Thank you.
Jose Luis, I know you were having technical difficulties, but hoping I can see you, so hoping you can speak up too.
I hope so. Thank you very much. And I am very pleased to be with you, particularly with Jeff, old friend, and Barb also, our colleague from the World Medical Association. Thank you very much. May I speak in Portuguese?
Absolutely.
So I will do it. I will change to Portuguese. So, eu sou anestesiologista e intensivista e atualmente presidente da Associação Paulista de Medicina e da Academia de Medicina de São Paulo. São Paulo tem atualmente 140 mil médicos em atividade e a população do estado representa 40 milhões de cidadãos brasileiros. Eu fui presidente da Associação Médica Brasileira e fui presidente da Associação Médica Mundial há aproximadamente 10 anos. Atualmente sou membro da Academia de Medicina do Brasil. Eu gostaria de lembrar que o progresso científico e tecnológico muito acelerado em função da interação entre os clínicos e a indústria de produtos biomédicos trouxe-nos a nossa realidade um mundo que supera os mais criativos ficcionistas da história. Penso que o Asimov, o Júlio Verne e o Arthur Clarke certamente não conseguiriam superar aquilo que nós estamos vivendo hoje. Hoje nós somos capazes de conectar milhões de cérebros através de fibra óptica com uma velocidade próxima da luz, o que nos parece muito lento quando nós imaginamos qual a velocidade de comunicação entre os nossos próprios neurônios. Hoje nós podemos nos fazer ouvir e ouvir em todos os cantos do planeta e podemos ver e nos fazer ver também em qualquer lugar do planeta. Nós viajamos a outros planetas e nós também viajamos ao interior das nossas células. Nós decodificamos os nossos genes e somos capazes até de modificá-los e fazer o mesmo com os genes dos seres que nos cercam. Portanto, nós nos tornamos capazes de diagnosticar, de prevenir doenças antigas e doenças novas. Mas, como vê-se, estamos muito longe de ter vida saudável, porque os benefícios desse progresso, esses enormes benefícios, estão muito distantes de uma considerável parcela da humanidade. A saúde é um bem que só nos alcança se ele vier a partir do coletivo, a partir da coletividade. E o desafio dos nossos tempos é estender todo esse progresso aos bilhões de seres humanos que não o conhecem. Não conhecem o que é saúde, desconhecem completamente o que é medicina. Portanto, esse é o nosso desafio, é trazer equidade, atenção à saúde, é oferecer cuidados de qualidade a todos. Como diria nosso prócer da Associação Médica Americana e da Associação Médica Mundial, faço aqui a homenagem a ele, Young Cobble. Todos nós nos lembramos muito bem do Young Cobble. Young Cobble dizia que sempre que medicina é cuidado, é ciência, é ética. O cuidado vem primeiro e o cuidado nos traz a credibilidade, a proximidade para que nós possamos exercer a nossa profissão. A ciência é uma ferramenta que é essencial para que o cuidado seja traduzido em resultados. E a ética é a correta aplicação destas ferramentas, da ciência ao cuidado. Portanto, dedicar atenção a esses 3 pilares que dão sustentação à medicina e fazê-lo igualmente é absolutamente essencial. E este, penso que seja o desafio que nós temos a enfrentar, mas ferramentas, isto é, oportunidades, isso não nos falta.
Thank you, Jose Luis. So I'm just going to try to summarize for the audience very quickly some of the concepts I heard. I think all of you talked a lot, and I think that's the importance of this panel, the standing of healthcare professionals in society, the trust and the ethical behavior, being able to model that ethical behavior, whether it's through industry codes or having a voice, and being really advocating for the patients being very important. I think another concept that was brought up that's very important is reflecting on potential conflicts so that we can always put care of the patient first. And then Jose Luis, I think you brought in a lot of good points with, just the evolution of the science and how you utilize that science in an ethical way to make healthcare available for everyone. So some really important principles right out of front. Gentlemen, I hope I got most of them there. So I think, we've talked about trust, we've talked about credibility, we've talked about using the science, avoiding conflicts, and also trying to make sure that we have healthcare applied equally for all. Did anything change for any of you with COVID? So I know all of you must have been at the forefront dealing with patients. It's been quite an evolution from, just as I saw it as a potential patient and someone in the healthcare industry, of being faced with, as one of you put it, a healthcare crisis, and actually learning along the way. And so the care has evolved, the interactions have evolved. Very curious to hear, if you would share with the audience any learnings from COVID that would change the way that you practice medicine, or any learnings from COVID that you think have, an impact on the ethical principles we have, whether it's interaction with industry or patients. Again, just for simplicity, I'm going to go in alphabetical order. So David, I'll start with you.
Thank you. So I guess I will start by saying, if we haven't learned, shame on us. We have had an opportunity in this pandemic to take a good, close look, both at ourselves as a medical profession, our healthcare systems, as well as the partnerships that we have with those stakeholders outside of medicine. I think what some of the learnings are, we were not prepared for a pandemic of this scope and duration. I would say that we do perhaps a credible job at generally preparing for disasters, but those are the disasters that are limited in geographic scope in most cases and limited in time duration. A hurricane hits the southern coast of the United States, or an earthquake hits a part of the Southeast Asia. We can mobilize resources from other parts of the country or the world to come to their aid. And we know that while the event itself is over and the cleanup will take some time, there is a finality or a finite timeline that we can consider. What we're seeing with this is that none of those are the case. This is both broader in scope. It's impacted almost everyone at the same time. We have found that often our supplies and our supply chains were not up to the task of meeting the needs. And I think the other part of this, as we relate this back to ethics, is we found that we, to the extent we do a good job at all, we do a better job with what I would call the technical part of the planning than we do with the ethical part of the planning. Because as we faced challenges in supplies, personal protective equipment, emergency medical supplies, even healthcare facilities and hospital beds and ventilators, we found that when we were forced to make ethical decisions about prioritization, we were probably not quite prepared for that. So we can learn, I think, to be more explicit in our ethical preparation for disasters such as this, just as we will become more explicit with regard to our technical preparation.
Thank you, David. Jeff?
Thank you. Yeah, David made some really good points there. It's sort of reflected back to our experience with SARS, where Canada was one of the harder hit countries about 16 or 17 years ago. And out of that came a lot of reports about what we should do differently next time. And we put them on a shelf and let them gather dust, and we didn't learn from that. And so we found ourselves, just as David says, in this sort of acute situation, having to very, very quickly learn from the experiences of the countries that were hit first and try and sort of adapt to that. So one of the first things we did at the CMA was develop a triage protocol in the unimaginable circumstances where we would be having to make life or death decisions. So there were a lot of really core fundamental ethical issues very early on, that we had to grapple with very quickly. And now we're on to the really crunchy issues of the equity of global vaccine distribution, vaccination mandates, converting anti-vaxxers, all these other types of really difficult issues. I just wanted to spend a minute just sort of unpacking. David alluded to the supply chain issues, and this is something I've been fascinated in, is this new intersection between medicine and private business that's always existed. It's always been there, but it hasn't impacted frontline physicians, as far as I can tell, ever before in the way that we've seen this. So from day one, when we were struggling to procure personal protective equipment, and all of our medical associations were neck deep in that process, trying to make sure that our colleagues had access to masks and gowns and gloves and things that they needed, right up to today, where so many countries are struggling to procure vaccinations and the vaccines in the numbers that they need. We have not before seen this dependency on clinical care on the supply chains and private business. And to me, this is one of the things we really need to learn from this pandemic. And particularly now that we're seeing a lot of countries, not excluding my own, sort of turning to a nationalistic business approach, nationalizing some of the manufacturers, internalizing the supply chains. It all makes great sense in terms of each country doing what it can to avoid these problems in the future. The problem is that it doesn't help with our equity issue. And so low and middle income countries will continue to struggle. And in fact, the discrepancy potentially will get greater. And so I'm really interested to see moving forward how we try and square that circle between this idea that we need to have countries that can react quickly during a pandemic without relying on ships being able to make it through the Suez Canal, but at the same time, not ignoring the needs of countries who do not have the internal resources that they need. So, and I think we don't want to leave that solely up to the business community and governments. We need to have healthcare providers at the table, because as I said at the beginning, we really saw the impact on this from day one on the front lines. It wasn't a theoretical issue for us. This was very disconcerting for a lot of our colleagues.
Some really interesting observations there, David and Jeff. And Jose Luis, would you like to add your thoughts on that?
Yes, thank you. O que nós aprendemos? Eu gostaria de me limitar a dois aspectos. O primeiro é que os desastres, como o David mencionou, de qualquer natureza, eles têm se multiplicado nas últimas décadas, particularmente, seja em frequência, mas, sobretudo, em número de vítimas. Nós, ainda que saibamos disso, não estamos suficientemente preparados nem integrados para enfrentá-los. Eu penso que esta é uma lição que nós não podemos esquecer a partir deste imenso desastre no qual estamos imersos. Em segundo lugar, e mas não menos importante, é que ficou, mais uma vez, claro, algo que há muito tempo nós conhecemos. A peste não vem só. A peste sempre se acompanha da ignorância e da intolerância. A energia e a firmeza no combate à doença, ao vírus, no caso, ela tem de ser aplicada também com igual firmeza no combate à ignorância e à intolerância. E a comunicação, algo que o progresso tecnológico nos trouxe em imensa intensidade, a comunicação é essencial para identificar, para caracterizar cada problema e para nós discutirmos e chegarmos a soluções. A infodemia, ela se combate como a pandemia, com a informação correta. E a credibilidade, a transparência nesse mistério é uma condição sine qua non para que nós tenhamos credibilidade para encontrarmos soluções conjuntas. Nós temos de manter viva na sociedade a discussão de questões associadas a potenciais dilemas éticos. Nós não podemos, particularmente os médicos, vivermos isolados, dissociados do restante da sociedade nessas discussões éticas, porque nós, no momento que nós tivermos que discutir com dilemas reais, nós não conseguiremos assumir posições coordenadas e estratégicas com outros setores da sociedade. Portanto, as soluções com relação a questões de saúde, elas não serão encontradas apenas no setor da saúde, mas a partir da integração com todas as outras atividades da sociedade, incluindo discussão com os vários setores da sociedade dos dilemas éticos médicos. As soluções locais, as soluções regionais, as soluções nacionais, elas são inevitavelmente frágeis e efêmeras. Os problemas de saúde exigem estratégias globais e, basicamente, eu penso que seja isso que nós estamos discutindo e propugnando.
Thank you. So to sum up some interesting thoughts, which hopefully will lead to the next question, some things that I heard, lessons learned, I think, around preparedness. So the fact that probably most of our countries are very prepared or somewhat prepared for what I would call natural disasters of limited duration, but perhaps not as prepared for something like the pandemic. As we've seen, COVID's gone on now for more than a year and it has evolved. So heard some thoughts around, how we can better be prepared. I think, Jeff, you talked about it, the fact that, you kind of have a postmortem about this. A number of reports are written, but how do we get those reports off the shelf? And while we may not need it, or we hope we don't need it, have that playbook ready for the next pandemic or the next crisis. Like I said, hopefully we don't need it, but we should always be prepared, right? I heard some really interesting thoughts from, I think, all three of you about maybe more than ever before, the COVID pandemic has brought to light the partnership and the integration and the coordination that's needed between the healthcare professional community and industry and government when it comes to supply chain issues and, making sure the right supplies. I heard a little bit about the ethical dilemmas of when you have limited supplies and limited healthcare available, how do you make those decisions on how to allocate, whether it's treatment, supplies, vaccines, hospital beds? And then I think Jose Luis, but the last point I'd like to bring in, I think you covered a lot of those, is the fact that maybe this last year has highlighted more than ever for all of us the need for some global principles. So something like COVID brings to light the fact that it's not just a regional, local, or even national issue, but when we have a global issue, how do we apply those principles globally? I think all really important, and I do think the healthcare community plays a big part in that in terms of, you know, how do you decide to allocate patient care? What supplies go where? I heard a lot from all of you about communication and education around vaccines. You know, what is the science behind it? Why should people take them? What is the resistance? Educating people so they can make appropriate decisions on how to proceed. So with that, I'm going to take all of that, which is a lot, and I'm going to ask each of you to unpack it a little bit and maybe talk about what you would do differently. And maybe we can start by focusing it on some of these partnerships that we've talked about, whether it's the partnerships with industry or the partnerships with government. So let's start with that piece. And what would you do differently from a partnership perspective and expect from governments and industry? And where would healthcare professionals take the lead? Again, I'll go alphabetically. So David?
So many things. I will try to be brief. We have referred before to our medical organizations and what I would call frontline physicians who actually deal with these things, who have had the most direct and up close experience and who have walked into danger themselves to deal with the issues around this pandemic. While I have sincerely the greatest respect for my physician colleagues who have moved into administrative roles in our state and national governments, that takes them one step away. And I fear that they have not relied on their colleagues, those of us on the front lines, those of us bringing together physicians in a professional organization to pick our brains and get our responses. And so that partnership between healthcare leaders in governments and potentially, let's say, medical directors in industry need to interact more with the colleagues that are on the ground. I think that's number one. To take another turn, COVAX, while it hasn't been perfect, is an interesting model that we might be able to, certainly we can improve on it with respect to vaccines, but it is an interesting model that we might also extend to some of the other supply chain issues to look at how we can make distribution of essentials available to those countries that perhaps might have difficulty acquiring them on their own. We do need to do better in stockpiling those materials that we know now will be needed, particularly in the early days of another wave or a different pandemic. We cannot prepare a year's supply of everything everywhere, but once we have a distributed, appropriate international stockpile, then back to some of the comments Jeff made, we need to know how we are going to pivot our industry to gear up to produce what we need the most. I use ventilators as a very simple example. In the United States, at least, we converted old automobile manufacturing plants that weren't being used into ventilator manufacturing plants. We can think ahead. What industry could produce which good or service that would be needed in a pandemic? And let's plan for that. So that while we have an initial stockpile to get started, how will we meet the demand, some of which we may not be able to anticipate right now? And then lastly, we as health professionals have the best perspective on how do we then use the limited resources, because there will always be some limitation of resources, no matter how well we plan. How do we use those in the most efficient way? If I read directly from the WMA statement on medical ethics in the event of disasters, it says physicians should order priorities for treatment that will save the greatest number of lives. We know how to do that, and we can do that even with vaccines, and we're well into the vaccination process. But where there are still limited resources, we know how to direct those to those individuals that need them the most, that will prevent the most morbidity and mortality. And I will say that we simply have not done that well. We didn't do it well in the United States. It is probably not being done as well in other countries. For instance, in the United States, and I think in many other countries, the vaccines were prioritized to people over 65 and those with some chronic health conditions. That's fine. That's a good broad category. But even within that category, as broad as it is, we could have done a better job at targeting those individuals who needed the vaccine first and most. Even those who were not able to get to an access point to get it, we could take the vaccine out, and we didn't in most cases. So we've got a lot that we can improve on.
Thank you, David. I'll hand over to you, Jeff, to get your thoughts as well.
Yeah, thanks very much. I think, this is in many ways sort of the heart of what we need to learn from this pandemic, at a really high level. And I reflect back, Jose Luis, as always, has had so many eloquent pearls of wisdom in his comments. And one of them that I really appreciated was that healthcare problems require global strategies. And we really need to internalize this. And so I think back to all the great work that the WHO has done, for their flaws, like any organization. They really have stepped forward at this time and been very clear in terms of where we need to prioritize, the need for equitable distribution of vaccines. As David said, provided a clearinghouse in COVAX. They've really done a lot of excellent things. And what has it all meant? Not much. Because the real power comes at the national level still when it comes to healthcare. And so I think without the WHO, these important conversations would not be happening. But I think we'd still see the inequitable distribution of vaccines and other life-sustaining and saving therapies in countries like my own around the world. And this is a real problem. And so to me, the big conversation needs to happen at the intersection, to your original question, Sujata, the intersection of the profession, business and governments. And this is why I've become engaged in APEC. And you referred to this at the outset, Sujata, the work that APEC has done around the interface between healthcare and private industry. And the power of that organization is bringing those three layers to the table, which is so rare, and doing that in a transnational type of way, which is even more rare. And so you have these tables where providers, patients and the public, civil society, governments and industry come together. And it's done in a consensus building way that allows people to participate meaningfully and not feel like they're going to be outvoted or that their voice will not be heard. So it's not a model that necessarily lends itself to every issue, but it is something that can be very, very, very powerful. And I'd love to work over the next few decades, maybe, to try and leverage some of the things that we learn in that setting to the global setting. Because again, to me, this is the real challenge coming out of this, is that, you look at some countries, I mean, New Zealand locked themselves down yesterday with one new case, right? Very wealthy country, citizens that listen very carefully to their government, superb engagement of healthcare professionals, and business fully integrated in the conversation, extremely successful in New Zealand, right? How do we learn from that and take that outside of the borders, whether it's on a regional or a global basis? To me, that's what we really need to learn from this pandemic. Some countries have done a great job, but internationally, what it's really done is exposed on a scale we've never seen before, the profound inequities in access to healthcare around the world. Thanks.
Thanks, Jeff. And Jose Luis?
Esta uma situação muito interessante que dá margem a tantas tantas possibilidades em termos de olhares, né? Nós, quando vivemos um desastre de qualquer natureza, frequentemente nos mobilizamos para controlar a situação, mas uma vez passada a onda inicial, o problema inicial, nós o esquecemos, radicalmente o esquecemos. Eu vou lembrar um episódio de aproximadamente 10 anos. Há 10 anos, eu me encontrava num hospital canadense, lá o Jeff vai lembrar dessa história. Eu me encontrava no hospital canadense em Lecaí, no Haiti, e trabalhando num projeto humanitário no enfrentamento do terremoto do Haiti. Naquela vez, não era possível para nós trabalharmos em Porto Príncipe, porque a cidade estava muito afetada pelo terremoto, e nós fomos para Lecaí. E hoje, exatamente 10 anos depois, temos outro terremoto que afeta diretamente Lecaí, exatamente destruindo o hospital onde eu havia trabalhado 10 anos atrás, e que, portanto, me pareceu algo assim, paradoxal, inadmissível, como o mundo inteiro tivesse acompanhado aquele desastre e nós o deixássemos repetir-se 10 anos depois, exatamente no mesmo lugar. Então, nós não podemos deixar que isto aconteça outra vez. Quer dizer, o que está acontecendo conosco hoje não pode se repetir. Nós temos de levar isso adiante. Apesar de nós hoje termos, e comprovadamente, um imenso poder tecnológico, é fascinante como conseguimos desenvolver em um ano, em menos de um ano, não apenas desenvolver vacinas, mas como fazê-las serem aplicadas em tantos milhões de pessoas tão rapidamente. Então, é fantástico isso, é fantástico nós percebermos que nós conseguimos desenvolver medicamentos efetivos, ainda que caríssimos e inacessíveis atualmente, para o enfrentamento de uma nova doença. Mas é absolutamente importante que nós tenhamos humildade suficiente para entender que todo esse conhecimento apenas nos dá a dimensão da nossa ignorância, de quanto falta para conseguirmos. Então, nós precisamos realmente muita cautela, não esquecer aquilo que nós já enfrentamos, tentarmos nos manter no terreno, no sentido de evitar a repetição de problemas anteriores, que é o caso desse desastre que estamos enfrentando aqui no Haiti. E só para terminar com uma observação que o David fez aqui no início, eu, durante muitos anos, trabalhei com ventilação artificial e conheci um engenheiro notável aqui no Brasil que desenvolveu talvez os melhores equipamentos de ventilação com os quais eu tive vontade de trabalhar. E, tendo encerrado a sua empresa, o que foi uma grande perda para o país, nós só sentimos agora quando nós percebemos que nós carecíamos de produção local de equipamento de qualidade. Ao encerrar a sua empresa, ele resolveu dedicar-se à produção de equipamentos essenciais que não tivessem como primeiro objetivo o resultado financeiro, mas a eficiência em qualquer lugar do mundo. Baixa manutenção, fácil utilização e durabilidade. Muito bom. Eu penso que um consórcio de engenheiros no mundo inteiro buscando isso, paralelamente ao desenvolvimento de tecnologia de ponta, seria fundamental, porque nós precisamos desse tipo de união. Nós talvez precisássemos também, e nós temos aqui material suficiente para muitas e muitas reuniões daquela Aliança Mundial de Profissionais de Saúde, porque os médicos isoladamente têm muito o que fazer, mas eles podem ir muitíssimo mais longe, associando-se ou aliando-se aos demais profissionais de saúde. E, evidentemente, que a nossa aproximação com a indústria de equipamentos médicos e farmacêutica precisa também se fazer neste sentido, no sentido de essenciais. E os essenciais nos faltam hoje, nos faltaram muito há muito pouco tempo e vão nos faltar num futuro muito próximo. E muitas vezes nós precisamos aceitar isso, nós precisamos ter humildade para reconhecer isso.
Thank you, Jose Luis. So again, I'll maybe unpack this a little bit for our audience and try to combine all of your thoughts. So, and I'm going to start with Jeff's comment about collaboration. So, the importance of forums like this one, where we can bring multiple stakeholders together, where we can collaborate and work together on, on issues, whether it's ethical principles or a crisis or a pandemic, just the ability to have forums, openness, and collaboration. I think all of you talked a little bit about extending that collaboration to thinking globally, not locally. So the importance of having global principles. And then Jose Luis, I think very important point, which we've kind of talked about a little bit before, is we need to learn from the past and not forget about the past, but use the past to help us move forward and deal more effectively with new issues. And I do think all of us, once we get past a situation, often move on to the next crisis. And we forget about those lessons learned until we have to dust off those reports again. And then just an interesting thought that I think came up through all of your conversations, especially talking about ventilators, which is the importance of innovation. So, Jose Luis, you talked about the gentleman in Brazil who kind of moved from ventilators to other, important medical equipment. David, you talked about how, in the US, we converted automobile plants to make ventilators, but maybe thinking innovatively ahead of time about things that could help us prepare for the future, even if we don't, have the automobile plant up and running, but knowing that we could have it up and running if we needed those ventilators. And so to me, one of the things, and I hope our industry colleagues are listening, because I do think innovation is one of those places where the industry and healthcare professionals and the government can work very closely together. And then I don't want to lose sight of one very important principle, and I think it came up through all your conversations, which is the importance of the healthcare professional who's actually on the ground, because they're dealing on the day-to-day, and they are our best source of intelligence of what's needed. So hopefully I summarized that. We're getting close to end of time, so I'm going to give you a one-word challenge. I would like each of you to think about one word, or maybe it's one sentence, that describes the most important ethical principle that you think we should be focused on. And David, you beat me to it. You've already unmuted. So
It's a pattern here. I think equity and justice in distribution is what we must strive for, and everything else is how do we get to that point.
yeah.
So in homage to my American colleague, David, Bill Clinton once said when asked about the key issue in the upcoming election, it's the economy, stupid. And in this case, it's global inequity, stupid, all day.
Jose Luis.
Não, eu não tenho qualquer dúvida, eu penso que somos aqui todos unânimes. A equidade no cuidado é o desafio dos nossos tempos.
Thank you, all three of you. Totally agree. Equity, justice, distribution of healthcare are very important. I'd like to thank all of you, as well as those that joined us to listen to this panel. I think we got some wonderful insights on the role that healthcare professionals can play in helping advance ethical principles, given their role in trusted advisors, the intelligence that they bring to the ground, the importance of collaborating together, both as industry, government, and healthcare professionals, and frankly, the importance of forums like this where we can collaborate and thinking globally, not just locally. So with that, I'd like to thank everyone and hand over to Andrew.
Thank you so much, Sujata, David, Jeff, Jose Luis, really for sharing these absolutely vital perspectives from the healthcare professional community across the region and around the world.